Stomach cancer, also known as gastric cancer, develops in a lining of the stomach and can spread to other areas of the digestive system. It is often diagnosed in later stages due to vague symptoms in the early stages, making awareness of risk factors, symptoms, diagnosis, and treatment options crucial for early detection and management. Types of stomach cancer. Adenocarcinoma. This is the most common type of stomach cancer, originating in the glandular cells of the stomach lining. It accounts for about 90 to 95% of all stomach cancers. Lymphoma, the type of cancer that starts in the immune system cells found in the stomach lining. Primary gastric lymphoma is rare but can occur. Gastrointestinal stromal tumors. These tumors begin in the connective tissue of the stomach. They are rare and can be either benign or malignant. Carcinoid tumors. These are neuroendocrine tumors that can develop in the stomach, though they are less common than adenocarcinomas. Risk factors. Several factors can increase the risk of developing stomach cancer. Helicobacter pylori infection. This bacterium, which can cause stomach ulcers, is strongly associated with an increased risk of gastric cancer. Age. Stomach cancer is more common in older adults, with the majority of cases diagnosed in individuals over 60. Gender. Men are at a higher risk than women. Diet. A diet high in smoked, pickled, or salty foods, and low in fruits and vegetables may increase risk. Consuming processed meats and nitrates has also been linked to stomach cancer. Smoking. Tobacco use is a significant risk factor for stomach cancer, particularly in the upper part of the stomach. Family history. The family history of stomach cancer can increase individual risk. Genetic conditions like hereditary diffuse gastric cancer syndrome associated with mutations in the CDH1 gene also elevate risk. Previous stomach surgery. Individuals who have had part of their stomach removed gastrectomy for other conditions may have an increased risk. Chronic gastritis. Long-term inflammation of the stomach lining can be a contributing factor. Pernicious anemia. This condition, characterized by vitamin B12 deficiency due to lack of intrinsic factor, is associated with increased risk. Symptoms in the early stages. Stomach cancer may not cause noticeable symptoms. As the disease progresses, the following symptoms may occur. Indigestion or heartburn. Persistent or worsening indigestion can be a warning sign. Bloating or a feeling of fullness. Feeling full after a small meal or bloating can indicate gastric issues. Nausea and vomiting. Frequent nausea or vomiting, especially if it includes blood, is concerning. Loss of appetite. A sudden decrease in appetite can occur. Weight loss. Unintentional weight loss may happen as a result of decreased appetite or other symptoms. Abdominal pain. Persistent or severe stomach pain may develop. Fatigue. General tiredness and weakness can be symptoms of various underlying issues, including cancer. Diagnosis. Diagnosing stomach cancer typically involves several steps. Medical history and physical exam. A healthcare provider will review symptoms and medical history and conduct a physical examination. Endoscopy. A procedure where a thin, flexible tube with a camera endoscope is inserted through the mouth into the stomach. This allows direct visualization of the stomach lining and the opportunity to take biopsies of suspicious areas. Biopsy. Tissue samples obtained during an endoscopy are examined under a microscope to determine if cancer cells are present. Imaging tests. Imaging studies such as X-rays, CT scans, MRI, or PET scans may be used to assess the extent of cancer and whether it has spread to nearby organs. Blood tests. While no blood test can definitively diagnose stomach cancer, tests can help assess overall health and detect certain markers that may suggest cancer. Staging. Stomach cancer is staged based on the size of the tumor, whether it has invaded nearby tissues, and whether it has spread to lymph nodes or distant organs. The stages range from 0 carcinoma in situ to IV advanced cancer that has spread to distant sites. Treatment options. Treatment for stomach cancer depends on the stage. location of the tumor, and the patient's overall health. Common treatment options include surgery. The main treatment for early-stage stomach cancer may involve the surgical removal of the tumor. Types of surgery include partial gastrectomy, removal of part of the stomach; total gastrectomy, complete removal of the stomach; lymph node dissection, removal of nearby lymph nodes for examination; chemotherapy, uses drugs to kill cancer cells or stop their growth. It may be administered before surgery neoadjuvant chemotherapy to shrink tumors or after surgery adjuvant chemotherapy to eliminate remaining cancer cells. Radiation therapy. This treatment uses high-energy rays to target and kill cancer cells. It may be used in conjunction with chemotherapy or as palliative care to relieve symptoms. Targeted therapy. Drugs that specifically target cancer cell characteristics. For stomach cancer, targeted therapies may be used for cancers with specific genetic mutations, e.g., HER2-positive gastric cancer. Immunotherapy. Treatments that help the immune system recognize and attack cancer cells. This approach is being researched and may be applicable in specific cases. Palliative care for advanced stomach cancer. Palliative care focuses on relieving symptoms and improving quality of life. This may involve pain management, nutritional support, and psychological support. Prognosis. The prognosis for stomach cancer varies based on several factors, including the stage at diagnosis, tumor type, and the patient's overall health. Early-stage stomach cancer has a better prognosis compared to advanced stage disease. Regular follow-ups and monitoring after treatment are essential to manage any recurrence. Conclusion. Stomach cancer is a serious and often late-diagnosed condition that can significantly impact individuals and their families. Understanding risk factors, recognizing symptoms, and seeking prompt medical attention can aid in early diagnosis and improve treatment outcomes. If you have concerns about stomach cancer or experience persistent abdominal symptoms, it is important to consult a healthcare professional for evaluation and potential screening.